Access to health services remain a big challenge for Kenyans living in frontier counties, including the Maasai Islands. With drought and high temperatures having affected the livelihoods of poor communities here, families can hardly afford to pay for the healthcare required. Women and girls have consequently borne the brunt of a starved healthcare system, with infant mortality rates and teenage pregnancies on the rise across the region. Health, income and conservation are connected. Impoverished communities often turn to illegal extraction of resources from protected areas to reduce economic stress. As the land becomes more degraded, its ability to support livelihoods like pastoralism gets weaker and the cycle goes on.
The conservation and human population is very important because, as you know, the more the human population, the more possibility for degradation of environment.
Maternal health and family planning was and is still a sensitive subject among some of the pastoralist communities. It was a subject that was regarded as a taboo and frowned at, that denied women and girls access to sexual reproductive health. With time, however, the narrative has been slowly changing, thanks to the efforts of Big Life Foundation, which is spearheading health programs in the community services within the Amboseli Wildlife Corridor.
In 2018, we started in Brikani Group Ranch, whereby we supported 4 facilities. On maternal health, we are having some aspects that we support, starting from immunization, skilled delivery, antenatal care, and as well as family planning. As conservation efforts started here in Amboseli, that is also a wildlife corridor, it saw an uptick of family planning methods and improved maternal health among the Ma community. At the center of this campaign is community health volunteer Joan Katei, who journeys across the grasslands of Amboseli on a border to create awareness and provide education on maternal health care and family planning.
We go around sensitizing communities on the importance of maternal health issues. We listen to the myths and misconceptions around family planning, and we dispel those myths. When the program started, we only had 130. In 2022, we had 4,500 women.
I can say, due to awareness and sensitization that our officers have been doing, have really empowered many people within our areas. I'm one of the key benefactors of the health in terms of maternity and family planning within Kimana.
Hiyo mbeleni, sisi wa Masai mbeleni, ajui mambo ya kusema fulani. Family planning. Ajui. Ikawa mbeleni hata hii mwanamke akichelewa hajazaa inaweza kuchapa. Kwani umechelewa. Naona kama ni mwanamke na nataka kutenga. Hata mambo tulikuja kubadilika. Hata mambo ya shule alikuja kukalia sisi, ikawa hata kama ajui fulani kutenga mambo ya kuzaa, lazima wao wanatenga mwenyewe. Kwa sababu ile watoto akishikana utashindwa kufanyaje? Kusoma. Mpaka hii upate muda, saa hii upate muda kama mwaka 5 uende upata mtoto mwingine.
Mimi nilikuja nikapanga kwa mtoto wa kwanza. Nikaja kujifungua mtoto alikuwa na miaka 5. Akaona ni nzuri. Juu huyo sasa amesoma kwa grade 3. Na huyo mwingine sasa ako na miaka 1.
We are done short of the commodities because they are being used. There was a time, because I've been in service, there was a time the commodities used to expire because there were no people who were interested in using, because there were a lot of myths and misconceptions. Out of these community dialogues, we engage even the men. Like, you know, kitambo, the women could not just use the family planning because of fear, like the men do not accept them to use. But now when we go to the community dialogues, we don't only educate or talk to the consumer of this product like the women, but we do it holistically. We even engage the men. So we even get a gentleman coming with the wife saying, we want to have this family, but what can we use?
As a community that largely relied on home births, through traditional birth attendants, community dialogues on the importance of hospital delivery and child immunization has significantly reduced child mortality rates.
Zamani mama mzee hakuwa anataka tusalie hospitali. Na ukizalia nyumbani atushikagi nini hiyo, mama mzee anasema hakuna kushika maji. Wakati ambaye hakuna matibabu kupeleka watoto clinic, walikuwa wanatumia mafuta kuwapea watoto na kunyonyesha tu. Unaweza kuta mwingine amepass kwa sababu hizo mashida juu hakuna nini dawa ya kutumia, amedungwa. Unakuta amepata hiyo shida kwa sababu ya kupewa mafuta. Unaweza kuta mwingine anampatia mtoto mafuta zaidi na ifai.
Hawa madaktari wale wa mama, mbeleni sisi najua madaktari wale wa mama. Akisikia mama funufunu kidogo na kimbia kuenda kuita, alete, aje afanye mwenzake kwa mkono. Naona ni daktari tayari amepata daktari, lakini siku hizi hata hawa anakuja kusukumia sisi. Mama akisikia kidogo, apeleke hospitali.
Most of these areas are hard to reach areas where maybe mothers are not able to come to bring their children for immunization. Some are not even able to come for antenatal clinics. If you can see from our records, we no longer have those mothers or the children who have defaulted. We have traced all of them with the help of the backpack. Currently, we are having an average of 20 deliveries in a month. We have been able to offer operation that is cesarean section in our facility, which is very key because of maybe in terms of saving time, because before they could refer a mother maybe to Loitoktok. So in terms of saving time and maybe saving the life of a mother, we are able to do.
Child Right Clubs program have also been initiated in over 40 schools across Amboseli to help young people learn about sexual and reproductive health for long-term intervention.
In collaboration with the Ministry of Education and the Ministry of Health, we started Child Right Club in schools. And we build capacity with the teachers, whereby they are the one who will be teaching these children, counseling these children on the importance of education and everything.
Every school within here have a club, but we have sometimes time that we can bring these learners together. But mostly, each school deal with that club, and we usually teach them during these club sessions in schools. We have the clubs session from 3, 10 downward. We can educate them about their rights, their fundamental rights, and also the sexual reproductive health. We also have the youth, who actually sometimes we engage them to come and talk to these young boys and girls, and they also go to villages, taking the same information, and if they got those challenges there, down the villages, they report to us. They know where to take the information. They bring the information to us. We also inform the school administration, going that way to the chief, until if the case can be solved in a lower area, that is it. But if sometimes you see that this one persists, that it needs some legal intervention, it goes like that.
As conservation brings about peaceful coexistence between wildlife and humans, it is also impacting lives communally and progressively. And as healthy people are able to work and less likely to resort to the illegal harvesting of resources from protected areas, communities are better able to engage in social and environmental change. Bentura Komboka, K24 TV from Amboseli, Kajiado County.